Hi, my name's Daniel. I'm a pharmacy intern. Are you Ian?
Yeah, that's me.
Hi, Ian. Could you just verify your date of birth?
August 14, 94.
Perfect. So I have a prescription here for the TrueMETRIX Glucometer. It should only take about 10 minutes to go over the instructions if you have about 10 minutes. Is that okay?
Yeah, that sounds good.
Perfect. Do you mind if I open the box?
No, absolutely.
Perfect. What did your doctor tell you that this prescription was for?
It's going to help me keep track of my blood sugar.
Correct. So this is a blood glucose meter which you will use to check your blood glucose levels at home. Have you ever used a blood glucose meter before?
I haven't used it before, and honestly, I'm actually a little bit worried about having to constantly prick my finger and draw blood.
No worries. I get that concern a lot from many patients. I promise with my instructions, you will be an expert at this and you won't even notice a single prick. How did your doctor tell you to use this prescription?
Something about using it once a day, but I also figured a lot of the details you talked about. We should go over it.
Okay, no worries. So the instructions say to check your blood glucose levels every morning before your first meal. The prescription comes with 1 meter and 100 test strips with 3 refills. The meter comes in a kit just like this. Inside the kit, you will see the lancing device used to prick your finger, the test strips, which you will collect your blood sample on, and the glucometer, which stores the memory of each reading and the date and the time. First, when starting to test your blood glucose levels, I want you to remember to wash your hands with soap and water. And now that your hands are clean, we'll start with the lancing device. You'll open the lancing device on the top and take out a new lancet, which is the blue stick with the blue circle on top. You'll put the lancet inside with the circle still facing upward. You'll twist the circle off, exposing the needle on top. Be careful not to prick yourself at this point. Then you'll take the lancing top and put it back on top until you hear the click. Then you'll select the depth at which the needle will go into your skin, 1 being the most shallow and 5 being the deepest. I would recommend starting at 1 or 2, and if you notice that you're not getting a lot of blood, then go ahead and move it up to 4 or 5. Next, we're going to prepare our testing sites, which are going to be your fingers. I would recommend using the edges of your fingers because it's not going to hurt as much, and because we use the pads of our fingers every day. There are alternate testing sites that you could use, such as your palm or your forearm, but those aren't preferred, and those will sometimes give you an inaccurate reading. So to get the best reading, remember, we want to use the edge of our fingertips to collect the blood sample. Next, we're going to load the meter with a test strip to have it ready. You'll take the test strip out of the vial, checking the expiration date first to make sure that has not passed. The test strips are good for 4 months after you open this vial, or the expiration date, whichever comes first. You'll insert the test strip with the metal chip facing upward into the glucometer. It should turn on automatically. Now that it's ready for the reading, you'll take the lancet and activate it by pulling it backwards and putting it on the edge of your finger and releasing the needle by pushing the button. You'll feel a small prick in your finger. As the blood comes out of your finger, you'll take the test strip and the glucometer and gently touch the blood sample on your finger. Do not scoop the blood, do not drip the blood, do not try and attempt a second blood drop. All important to get a correct measurement. Now that you have your measurement, you can dispose of your items that you used. First, you can take the lancet cap off the lancing device and dispose of the needle into a puncture-resistant, hard-sided container with a lid. Just collect them all, and when it's full, you can go ahead and tape the lid and throw it in the trash per Colorado law. For the test strips, you can go ahead and just throw these into the regular trash can. I recommend storing everything in this carrying case. If you keep it all together, it will be less likely that you lose anything. You'll keep these in here in a dry, room temperature place away from direct sunlight. Do not store it in the fridge and do not store it in the freezer. It's always important to remember to use a new lancet at every single blood glucose check and a new test strip every single blood glucose test. You want to use a new lancet to avoid any infection or irritation. And obviously you want a new test strip to get a new and accurate reading every time. What did your doctor tell you to expect?
He said if I was good about this, it would help us like pinpoint how to go with our therapy going forward.
Correct. So testing your blood glucose every morning will help you and your doctor decide on the best diabetes management plan for you. It can also help you predict how much insulin you will use each morning and how your body responds to certain glucose levels in your food. What goals did you and your doctor review?
He gave me some specific parameters for blood glucose target goals, but I forget them.
All right. Well, let me just remind you, when you're checking your blood glucose, you want your levels to be between 80 and 130, and that's before you eat a meal. After a meal, you want to keep your levels below 180. I know those numbers sound a little confusing, but I'm sure you can remember them. All right. In the event that you take your blood glucose and it's way above 400, this is concerning and I want you to reach out to your doctor right away. If you find yourself taking measurements below 70 often, that's also concerning and I want you to reach out to your doctor right away. If you have any questions about the glucose meter, we're always here to answer any questions. Just so I was clear, what were the glucose goals that you were aiming for?
I think I'm gonna try to find myself beneath 180 after a meal, and then between 70 130 between meals.
Perfect. All right. And how long can you keep the test strips after you open them?
4 months.
Or after the expiration date, whichever date comes first.
Okay.
Perfect. All right. Like I said, we're always here to answer any questions, and I'm confident that you're going to do great. Thank you for your time.